Greetings. Today I'll be discussing how long stem cell therapy results typically last and what you can expect in terms of cost. Stem cell therapy has become one of the most talked about regenerative treatments in modern medicine. People seek it for joint damage, chronic pain, anti-aging, autoimmune issues, and overall tissue repair. But two of the most common questions patients ask are, how long do the results actually last? And what does stem cell therapy cost? Below is a clear breakdown based on current clinical practices and real-world outcomes. If we haven't met already, I'm the digital avatar of Dr. Max McLeod, also known as the Nutrition Ninja Doc, founder of MyBodySymphony.com and the STEM Region/Age Reversal Technology Center, CARTC.health. He is a problem solver with a focus on helping people overcome their health challenges and achieve their health, performance, and appearance goals. He is using this avatar to save time making videos that can be better spent helping people. My role as his avatar is to convey his knowledge and insights about health, healing, and regeneration. Please note that I'm an avatar of a doctor, and none of the information I convey should be considered medical advice. It is intended for educational and entertainment purposes only. Consult your trusted healthcare provider before making any significant changes to your health regimen. Doc Max also provides individual supervision, in person or virtual. Contact us at 9418-065-511 to learn more. Now let's get back to today's topic. Before that, I ask that you leave a like on this video if you find it helpful. And if you haven't already done so, please hit that subscribe button because it goes a long way to help get these health-related presentations out to more people. The duration of results from stem cell therapy varies depending on factors like the condition being treated, the type and quality of stem cells used, patient health, age, and lifestyle, severity of tissue damage, whether multiple sessions are performed, whether the cells are delivered properly. However, studies and clinical experience generally show the following time frames. Results typically last 1 to 5+ years. Many patients experience reduced pain and inflammation, improved mobility, increased cushioning in joints, slower degeneration. Some individuals maintain relief for several years, especially with lifestyle improvements and supportive therapies, PRP, physical therapy, etc. All tissues tend to degenerate for a plethora of reasons, including lack of one or more vital nutrients, reduced microcirculation to deliver nutrients, inadequate or inappropriate movement patterns and exercise, mitochondrial dysfunction, metabolic dysregulation, toxins, etc. Results typically last, long-term or permanent. Of course, nothing is permanent. The better phrase is good as new for the time being. If the tissue actually heals rather than just reducing inflammation, the improvement can be lasting since stem cells help regenerate damaged fibers. Results typically last 6 months to 3+ years. Stem cells can reduce inflammation and support partial disc repair. If degeneration is advanced, results may be shorter. If ligament attachments are properly treated and repaired, the results will tend to be significantly longer. Prolotherapy, the original regenerative injection therapy, is well documented to stimulate the repair of ligament and tendon attachments. The downside is that very few doctors are trained in or proficient in the technique. Results typically last. Skin rejuvenation, 12 to 24 months. Hair restoration, 1 to 2 years. Maintenance sessions are often recommended, as the underlying physiology that led to the problem typically remains. Results typically last 6 months to several years. Stem cells may help regulate immune activity, but ongoing treatment is usually necessary to maintain benefits. Age and overall health, severity of the condition, quality of stem cell source, bone marrow, fat, umbilical cord, etc. Umbilical cord-derived stem cells are the current gold standard. Dosage of stem cells, aftercare, rehabilitation, supplements, and lifestyle changes. Stem cell therapy is not a one-size-fits-all treatment. Your body's ability to heal plays a major role in how long the benefits remain. Stem cell therapy is typically not covered by insurance, so prices can vary greatly depending on the clinic, region, and treatment type. Below are average U.S. price ranges. 1. Joint injections, knee, shoulder, hip, ankle. Cost, $3,000 to $10,000 per joint. In the vast majority of cases, this is done as a single session, but that is not what I recommend at all. The body, even with a stem cell boost, can only heal at a certain rate. In my experience, the better approach is to spread the treatment out over 6 sessions to optimally stimulate the body's healing response. It is also crucial to make sure all the essential nutrients are available. That's why we include them in the program. Factors affecting price include stem cell source, amount used, and whether additional supportive treatments are included. We include several nutritional support and home therapy components in addition to in-office treatments, all designed to support the healing process stimulated by the injections. 2. Spine and disc treatments. Cost $5,000 to $20,000. More specialized procedures and imaging guidance can increase the cost. Additionally, disc tissue is more challenging to repair than many other tissues. Point. Third, soft tissue injuries, tendon, ligament. Cost $3,000 to $7,000, often less expensive because fewer cells or smaller target areas are involved. With joint injuries, typically several ligament and/or tendon attachment sites are being treated versus a more straightforward tendinopathy or sprained ligament repair. 4. Whole body or anti-aging stem cell infusions. Cost $6,000 to $30,000 plus. These are usually elective and vary widely, depending on the clinic and cell dose. The cost depends primarily on how many vials of stem cells and/or exosomes are chosen based on need and preference. 5. Autoimmune or systemic conditions. Cost $8,000 to $25,000. Costs depend on the treatment plan and the number of sessions required. Lab processing and cell expansion. Cell expansion is only done offshore and adds some risks due to increased mutations with expansion and replication. Lab processing is quite extensive. It requires proper collection and transport procedures, tissue dissection, preparation and extraction from umbilical tissue, isolation, filtration, concentration, characterization, testing, characterization, cryopreservation or lyophilization, and proper storage. GMP, good manufacturing practices, standards, and proper laboratory procedures. Medical imaging and guided injections when needed. High cell counts are required for regenerative outcomes. Specialized expertise. The quality of the product and the experience of the clinician significantly influence results and prices. How long does stem cell therapy last? 1 to 5+ years, depending on the condition and treatment quality. Some repairs may be permanent if true regeneration occurs. How much does it cost? Typically $5,000 to $20,000+ depending on the treatment type, number of areas involved, etc. Stem cell therapy can offer long-lasting relief and regenerative benefits, but outcomes vary. Patients should consult qualified specialists, inquire about the source of their cells, and choose reputable clinics for safe and effective results. That's exactly why we created the coaching program at Age Reversal Technology Center. If you're ready to stop guessing and actually get the results you've been reading about, call or text us right now at 941-806-5511. Your first 10-minute phone consult is completely free. No pressure, no sales pitch. We'll just tell you straight. Age Reversal Technology Center, 941-806-511-6968, Professional Parkway, Lakewood Ranch, Florida. Nationwide telehealth available. One phone call can change the next 10 years of your life. Make it today.